So we'd like to now invite Dr. Prithvi Chandrakanth. Yes, he'd be speaking to us on the SLITSCOPE, and the discussant would be Dr. Naresh Babu.
Start.
The presentation.
Good morning, all. No financial interest and no conflict of interest. I'll be talking about the SLITSCOPE.
Can't hear you.
Hello. Yeah. I'll be talking about the SLITSCOPE.
Only question.
So we all know that when we go to the outreach programs for camps, the only instrument that we actually have is a torch. Other than a torch, we don't have any other instrument, and taking a slit lamp is very bulky. It's very problematic. It could actually damage the slit lamp. So the problem statement was, can we replicate the slit lamp? So the solution we came up to was to three things: magnification, slit illumination, and imaging device. So we already have a imaging device which magnifies as good as a slit lamp, and that is anti-segment photography with the intraocular lens, where we use a small chart paper into which intraocular lens is pasted. In between it, around 15 or 20 diopter lens, and this will help us magnify the image once we put it on the smartphone. So the other problem was the slit illumination. This is where we are all lacking to replicate the slit lamp, and we introduce you to SLITSCOPE. These are my co-authors, and so we opened up the slit lamp and saw what are the illumination parts designed over there. So we had the LED bulb, a slit, and the lens. Over here we use the intraocular lens for the optics. Here you can see we use the slit over here, which was made using a chart paper. This one was a cut piece of a marker, and this is the intraocular lens. So with this, we made the adapter, which actually brings us the slit. As you can see over here, we could actually get the slit of the slit lamp. So this is the first image that we made. This was a slit of my own eye, and so after that we thought, let's make it more stable and make it 3D printed. So we actually 3D printed it with different diameters. Over here you can see the 1 millimeter circle diameter, here 1 millimeter square diameter, and here you can see a slit of 1 millimeter. We have even made 2 millimeter, 3 millimeter 3D printed adapters. So here you can see this is the adapter which is put onto the torch, and you can actually see the SLITSCOPE giving a slit. So this costed me around 350 with the torch. The torch plus the adapter 3D printed costed me around 350 rupees. And here are a few images. So with ASPI and SLITSCOPE, that is, we are not using any slit lamp, we could take images as good as a slit lamp. So these are the images which we took only with this ASPI device and the SLITSCOPE. You can see over here a corneal scar. We can actually increase the magnification by increasing the ASPI diopters, so that if we give 25 diopter IOL, we can even magnify it even more. You can see brown cataract and mature cataract over here. So this actually helps us in outreach programs where there is no slit lamp. You can actually magnify, you can take images, you can even grade the cataract, and this is very simple. It's very simple. You can just change. I have different adapters over here. You can change it to the desired ones, and then you can take images with this. It's cost effective. It is actually do it yourself, but we are even giving the 3D printed version, and it can actually be a very good alternate to the slit lamp. Thank you.
Thank you, Dr. Prithvi. Dr. Naresh, your comments, please.
So, the thing is, we already have slit lamp.
Yes, sir.
Recommend that for taking it to the camps. I'm just asking.
Actually, there are handheld slit lamp, but I don't think everybody has it, and it's actually expensive. This is just 350 rupees. The whole setup is 350 rupees. If you're 3D printing it.
The illumination. Can you adjust the brightness of the illumination?
At this point, yeah, we cannot actually adjust the illumination, but we filter, which would actually reduce the illumination.
The question is, have you ever compared the luminescence of this with that of a conventional?
Yeah, we are doing a study in which we are comparing the LOCS grade cataract with the slit lamp itself.
No,
It's
then-
actually very promising.
And the filter, any the fluorescent staining of the cornea.
Add a blue filter to the ASPE. We have already published an article in which we have used the blue filter on the ASPE. Then you can actually take the image of the same. Like
Thank
to
you.
see this?
You have a question? Sure.
Yes, sir. We'll just on this and then just take it like this.
Yeah.
Yeah, it is required. Yeah. Yeah, we can use it, but you will get only one particular diameter. But over here we have different adapters for different. You can have a circular one, you can have a square one, you can even have a slit one. Slit we can have 1 millimeter, 2 millimeter, 0.5. You can have different millimeters.
Any comparison using the ophthalmoscope slit and your slit? What the difference is?
Actually, the ophthalmoscope scope slit is a little more thicker. If you see this one, this is actually very thin. You can actually get a very good slice of the lens.
Okay, while using it, how are you going to adjust magnification? I mean, you have a patient in front of you, you have to assume that he's going to open his eyes very wide,
Yeah.
because you can't do that. On the slit lamp, you're using your
Yeah.
left hand
Yes.
and you're using the right
So if
for it.
it's a very uncooperative patient, then we might have
And how
to.
will you adjust for magnification on your phone?
Yeah, we can. We have a 20 diopter lens, and we can actually magnify and change the magnification.
The catch what she's pointing out is that we'll need another hand to
if it's
adjust the phone.
uncooperative,
But
yeah.
but I think, I mean, one of the problems that she pointed out is you could actually get a handle on which you could, a rotatable handle on which, so that again gives you a freer hand.
Yes.
Maybe next year we'll have you with that
Yeah.
and see you there. So thank you very much. Next.